Hello, good afternoon. My name is Kathleen Greeley, and I'm representing Juneteenth NYC Real Talk. The Juneteenth NYC Real Talk presents Live On New York as they present on improving lives in communities of color through organ donation. The panel will center around preventative health care, health equity, donation, disparities, end of life choices, and basic donation education. Live On New York is a team of over 200 clinicians, educators, social workers, and much, much more. They're all united around the life changing power of organ and tissue donation. They work tirelessly day and night, 365 days a year, to help save the lives of those in need of a transplant. They also provide support and comfort to donors and their loved ones throughout the entire donation process and years after. What's really great though today, in addition to all that they do, they're here to educate and inspire our community about organ and tissue donation. I'd like to introduce to you Shawnee O'Dane, who is also with Live On New York. She's our chat moderator today, and she'll be just introducing the rest of this wonderful panel today that will be sharing more about organ and tissue donation. She happens to be a community and government affairs specialist, if you will, with Live On New York. And Shawnee, how are you doing today?
I'm doing well. How are you, Kathleen?
I am doing fine, just really living for this wonderful presentation and all this great information about how we need to really give some attention to organ and tissue donation, in our community. This is a much needed topic, and I'll just pass this baton on to you.
Thank you so much.
So
Yes,
welcome.
because we definitely want to dive in
Mhm,
and get this information, get the conversation flowing. But
mhm.
again, I'm Shawnee Aldane of Live On New York. I'm the Community and Government Affairs Liaison. I cover Brooklyn for Live On New York. Our purpose at Live On New York, our main reason for existing is to save lives. We strive to educate, inspire, and create curiosity around organ donation and healthier lifestyles. Today, we're facilitating that goal through this discussion and through the amazing panelists and the information that we have compiled for you today. Can we go to slide 2 really quickly? I just want to touch on, give you a little bit of information as we are moving through. A lot of the health disparities in communities of color and Black communities in particular can be seen in the need of organ donation and transplantation. In the greater New York City area, there are nearly 8,000 people on the transplant waiting list. And if you take a look at New York State as a whole, there are more than 8,500. If you look at the United States as a whole, there are more than 100,000 people who are waiting for life-saving transplants. But getting back to New York City, which is one of our main focuses, 75% of those people are people of color. 36% identify as Black. Today, in this discussion, our purpose, as I mentioned to you earlier, is to explore the need for organ donation and transplantation in these communities. And we want to address the barriers that exist and explore ways that we can improve health outcomes for those in need of life-saving transplants. August is National Minority Donor Awareness Month. So that is the main purpose why we're doing this. We want to bring awareness about organ donation in communities of color. What I would also like to do is to introduce our moderator for today. I will be leaving you from the screen, but I will be moderating the chat. But you will be in in wonderful, capable hands in Dr. Ramonia Chapman. Can we go to slide 4 for Dr. Chapman's bio? Now, I will be honest, all of our panelists had bios that we had to trim because their accomplishments were just too vast. So just to tell you a little bit, and you can read along with me, Ramonia Chapman is a devoted health advocate whose career has included stints in various leadership roles across the country. Currently, the native Detroiter is program director of Gift of Life Minority Organ Tissue Transplant Education Program, which is the acronym MOTEP. And she's also the executive director of the Detroit MOTEP Foundation and is past president of the Association for Multicultural Affairs in Transplantation, and that acronym is AMAT. And we'll hear a little bit more about this organization before we close out from Dr. Chapman. But if you read the rest of her bio, her accomplishments in this field, her donation to this field has been absolutely amazing. So we are so honored to have her with us today to guide us through this very important conversation. So I'm going to turn it over to you, Dr. Chapman. Oh, and actually, really quickly, before I turn it over to you, we have a quick trivia question, which is on slide 8. If you could turn us to slide 8 very quickly, we're going to go through this trivia question, and then we will double back with you shortly to get your answers. But how many people are on the donor waiting list in New York City? I gave you this information, so you should be able to answer it. A is 6,500, B, 85, C, 9,000, D, none of the above. And anyone that chooses D, make sure you also have what you think the correct answer is if you don't see it here listed. Okay, so we'll be back with you to share what the correct answer is very shortly, but we're going to move on. I'm handing it over to Dr. Chapman. Thank you so much.
Thank you so much, Shani, and welcome to everyone for an exciting panel discussion on today. I am excited about being here with you, but more importantly, I'm excited about sharing with this phenomenal panel that we have today. Again, Shani mentioned that this is National Minority Donor Awareness Month. And so this is a time where we will share information about the importance of organ and tissue donation, about health disparities, and about how all of us can participate in this conversation. I have some exciting panelists that are here with me today. First and foremost, I have the Dr. Clive Callender, who is the founder of MOTEP. He's a professor of surgery at Howard University College of Medicine. He is a native New Yorker, and he was educated in their public schools and colleges. And I'm going to let our panelists really take the time to kind of share and tell you about themselves. But what I can say about Dr. Callender is he has been a catalyst in my life. My life is so much richer and better, both personally and professionally, because of Dr. Clive Callender. And so, Dr. Callender, I just want to say welcome. And so again, we have Dr. Callender. And so Dr. Callender, please share some things about yourself and what you want to share with us a little bit today about this exciting time that we're here.
I'm so thrilled and excited that we can have this occasion. I'm always thrilled to see National Minority Donor Awareness Month become a reality and have the opportunity to get people of color to become a great part of solution to the problem of the shortage of donors, which is our reason for existence. I really appreciate you letting me join you. I think you said enough about me. Let's move on to the subject at hand.
Okay. Well, then I have Dr. Callender, you're going to speak now, or am I going to have my other panelists join, who is Ms. Karen Cummings? Karen? Okay, is Karen going to join, or Dr. Callender, you're just going to take it on? Okay, all right. So Karen Cummings is my colleague there in New York. I am in Detroit. She is the Community and Government Affairs Liaison for Live On New York. She's a graduate from St. John's University with a Bachelor of Arts degree in 1991 with a major in criminal law. And so, Karen, I'd like to say welcome to the panel. And anything you want to share before as I just kind of bring everyone in?
I'm just happy to be here for National Minority Donor Awareness Month, and just so happy to be part of the panel to educate the community on this important cause.
Okay. All right. The next person that I'm going to bring on that's going to join this phenomenal panel is Nancy Ullen. Nancy, if I have mispronounced your name, please forgive me. If you could just kind of come on and tell us a little bit about yourself, that would be absolutely fantastic.
Absolutely. I'm a family nurse practitioner and current program manager at Dreyfus Health Policy and Research Center. We're located in East New York, and our work is affiliated with Dialysis Clinic, Inc., and really working towards creating a health and healthcare system that prioritizes wellness, disease prevention, and by really empowering and encouraging the person, and as well as applying earlier interventions to control or slow the disease progression. And I'm thrilled to be here with you all today.
Great. Thank you so much, Nancy, for joining us. And our final panelist that will be joining this discussion is Dr. Cherie Watson. She has received a liver transplant in June of 2015. And at age 21, she was diagnosed with an autoimmune disease called primary sclerosis cholinergic, which eventually caused end-stage liver disease and bile duct cancer. And so, Dr. Cherie, I'm going to ask you to come and join us and share a little bit about yourself, and then we'll kind of go back into our panelist discussion.
Good afternoon, everyone. It's my pleasure to be here today for National Minority Donor Awareness Month and this very important discussion that we're having this afternoon. I will tell you more about myself a bit later, but I stand here as the outcome of what donor awareness is all about. Organ donation saved my life. And so I represent those people that are on the other side of a topic that a lot of people are not aware of, the need and the shortage that is there. But I have been the beneficiary of a wonderful gift of life due to organ donation.
Okay, thank you. And to each of our panelists, I want to say welcome to you as we begin this discussion. And so at the beginning, there was Shani asked a trivia question, and she asked how many people are on the donor waiting list in New York City. And so I don't know who is going to answer that question and how we're going to go about getting that particular answer. But as she has shared that information with us. And so, the question is there 6,500, 85, 9,000, or none of the above? And, just, basic, multiple choice 101, you can forget number B, and you can definitely forget number D. And so as a result of that, what is the answer? Okay, I tried to play a trick on you. It was none of the above. The answer is number D. How many people in New York are on the waiting list? Okay. And so I'm sure that Shani is going to tell us that particular answer. But again, all of you are here today for as we celebrate National Minority Donor Awareness Month, because we know that there's a great disparity between those persons that are on the list and those persons who are sharing. And so one of the things that we know is extremely important is that persons in the community become involved in this particular conversation about organ and tissue donation. Okay, so the trivia question, I think we did get that, was slide 10. It was none of the above. But I think the answer truly is just under 8,000. So over 8,000 people, almost 8,000 people are waiting for an organ transplant in the state of New York. And so that is something that's very important, those are, these are just not numbers. Many times we hear these numbers and we think that, we can become desensitized, but these are people's mothers and fathers. These are people's sisters and brothers, their spouses, their children, our co-workers, and our family members. And so I want us to kind of keep that concept in our head as we go through this particular discussion. And so to help us lead into this particular discussion, I am going to ask that my colleague Karen Cummings from Live On New York come and talk to us and tell us, Karen, exactly what is Live On New York's role in supporting the community and families during the donation process. So I want you to kind of take us behind the walls of Live On New York and let us see exactly what happens in Live On New York.
Well, thank you so much for asking that question, Ramona. Live On New York really basically does everything. We are what is called the Organ Procurement Organization, or OPO. There's approximately 57 of us across the country, and we are the primary OPO in the New York metro area. So we handle everything that is involved with deceased donation, from the tip of Long Island all the way until the Poughkeepsie area. So we service an area of over 13 million people. And specifically, how we support the community who is in need and the families that give the gift of life is we are part of the process from the very beginning. So we receive notification of every death that occurs in our area. We get about 60,000 calls per year. We have a 24-hour donor service center that receives those calls. And then we start the process of checking to see if that individual actually has registered to be an organ donor. We have to verify that. And about 40% of New Yorkers have registered, which means that we are able to verify if that individual has signed up. And if they have, then we're able to notify their family that they have already registered and expressed their wishes to be an organ donor. If they have not, then what we have to do is ask their family or their next of kin if they would consent for their loved one to be a donor. So for a lot of families who have just received a notification of the death of their loved one, they are getting the first education on the importance of donation and really what it is. So for us, we are the front line, not only supporting the people that are waiting, like Cherie has explained in her case, but also the families that are going to make the decision about the gift.
Wow, thank you, thank you. And you just said something. You said that and I'm going to ask you a question, because I know that at the time of a person's a loved one's death, that's not the time to educate people about the importance of organ and tissue donation. And so
that's actually the worst time.
That is the worst time. So please tell me, as a community liaison for Live On New York, like I said, my colleague in New York, tell me, is your primary focus really just to register organ and tissue donors, or what else do you do? Because I know community people do a little bit of everything. So if you could just kind of give us a glimpse of some of the things that you do, that would be fantastic.
As you mentioned, it really is the worst time for a family to get educated about donation. Our goal is to hopefully have that family have that discussion over the dinner table way before they ever have to make a decision about organ and tissue donation. And our primary focus is not to register people. Our primary focus is to educate our community on the importance of this cause enough so that they can make an informed decision. And that means whether that is a yes to donation or a no to donation. But we want them to be informed enough that they have the information so that they can really make that decision based on all that information. So we do a lot. Shawnee, I'm sure, is also able to kind of express exactly all the things that we do. I handle the Long Island area, so Nassau and Suffolk County, in addition to Staten Island. So I actually handle 3 of our areas. In addition, I handle a lot of projects in between. As you mentioned, a community person basically wears a ton of hats. I mean, I was out yesterday at a community health fair. I was at a back to school rally in the morning and the community health fair in the afternoon. Not only educating the public on the importance of donation, but meeting with legislators, explaining what we do, and kind of encouraging them to support not only the cause, but the organization and the efforts that we make to try to educate the community on the importance of donation. So we do a lot, especially in New York, where, unfortunately, as I mentioned, about 40% of our population is registered, which in comparison to the rest of the country, most states have over 60% of their residents who are registered to be organ donors. So in New York, even though we have a large population, many of those communities of color that are in need of a transplant, a lot of people who are waiting in our area wait a lot longer than we think is necessary. So our goal is really to educate those communities and hopefully try to dispel some of the misconceptions, because we think those have been barriers to donation, not only for the people that are in need, but also the people that would take the action to actually register to be an organ donor.
Thank you, Karen. Thank you. And just like a little housekeeping, I know people are saying they're having a difficult time seeing the event. So you can always go to Facebook, and you can also go to YouTube and see the event. I think they have put the link in the chat for people to join us, because we want everyone to participate in this particular conversation. So you can go to YouTube or you can go to Facebook and join in. So, Karen, as you were talking, one of the things, and Joy, I'm sorry, under Umoja, UMOJA events. And so hopefully everyone will receive that information and definitely join with us. But Karen, why is it specifically for us to have this conversation, especially during National Minority Donor Awareness Month? What do you think is the impact of a conversation and a focus on communities of color, especially?
I think it's so important because I think, especially since we've been dealing with this pandemic right over the last year to year and a half, I think the focus on the importance of our health has really taken a step forward. And organ donation needs to be in that discussion, especially for communities of color who in our area are so greatly affected by the need for transplant, but are very hesitant about not only registering, but actually saying yes to a transplant when it becomes available. I mean, there are tons of people, I'm sure, and Nancy will discuss this, that are in our dialysis clinic that may be, waiting for a donation, but not knowing all the facts. I think this is a really great time during Minority Awareness Month to really educate our communities to really charge of our own health. So not only about organ and tissue donation if we are ever in need, but about prevention, about really taking the steps to be healthy enough that you hopefully will never need a transplant. But if you do, you understand all the steps, you understand all the facts, you understand the process of donation, and that you can really make decisions about your health that can empower you so that you can go forward and have the healthiest, longest life possible. So I think that it's really important for us to get that information out to our communities of color, because we're so greatly affected. More than 70% of the numbers of people that are waiting for transplant are from communities of color. So it's something that's really in the forefront for us. So it's important that we get our information.
Okay, I could not agree more. And I am excited that we're doing this particular panel as we are celebrating the 25th year of National Minority Donor Awareness Month. Something that began as a day and that is now a month. And we need all 31 of these days to definitely talk about it. So what are you, Karen, tell me, what are the best ways to ensure that your wishes are, to become an organ and tissue donation or an organ donor, are known? So what is the best way to make sure that everyone knows, that your family knows that you want to be an organ donor?
Well, I think in New York, we actually have taken steps to kind of incorporate organ and tissue donation into normal processes, right? So that when people hear about it, they're not kind of taken aback and surprised by it because it's something that's part of your normal things that you do all the time. For us, about 65% of people are going to register when they go to the DMV. So when they go to get their driver's license, they go to get their real ID. For us in New York, they're going to be asked the question. It's a requirement that they're asked. And then you have the ability to say either, yes, I'd like to be a donor, or not at this time, so that the next opportunity we can actually discuss organ and tissue donation with you. But then we're also part of other processes. You know, if you go to get health insurance in New York State, you get asked the question. If you go to register to vote, we're the only state that allows you to register to be an organ donor as part of that process, and been involved in a lot of voter registration activities. But that's only the first step. I think that the important second step is to have a discussion with either your next of kin or your healthcare agent as part of your healthcare process. I think it's really important that your family knows what your wishes are. It's really a gift you give your family that they know, so that when organ and tissue donation is discussed with them in the future, if anything were to ever happen to you, your family really understands why you made that decision, and then they can follow what your wishes are. So I think it's a two-stepper.
Okay, great. So I know we asked one question and we had a second trivia question. I'm going to ask this trivia question and have you to answer it, Karen. And it's like, how many lives can one person save with organ donation? And I want you to answer that question two ways. One is, how many lives can people save with solid organs, and how many lives can people save being a organ and tissue donor? And I know people have an opportunity to answer this question. So, you know, you have 4 choices, 1, 3, 8, and 6. I am not going to do any more multiple choice 101 and mess up. So you tell me, you know, you can please give us the answer and then answer it for both organ and tissue.
It's 8. One person can save 8 lives with solid organ transplants. So one person can make a huge difference as far as organ donation is, especially solid organs. And tissue donation, which I saw a little mention on the bottom, can be 50 plus lives. And it can be something really simple as, you know, bone that can be used for dental surgery. It could be used for knee replacements. We use skin that can be used for people who've been badly burned in fires. In New York, we've done probably the second or third facial transplant in New York State have been handled through LiveOnNY. So even though tissue donation is not life-saving, it is life-enhancing and life-changing. So one person can make a huge, huge difference.
And I'd like to add that I actually not only received an organ that saved my life, I also needed a tissue donation about 2 weeks after my transplant, because one of my blood vessels was not working properly. So I actually got transplanted a blood vessel that saved the organ that I had just been transplanted. So
that's
it
amazing.
Can help in many ways.
Yeah. So that just goes to show you that tissue donation is life-saving and life-enhancing. Thank you so much, Cherie, for sharing that. And so as we kind of come to almost the close of our first panelist, I just want to say, is there something that I have not asked you? If there was one thing that you'd like to share with us right now that I might not have asked you, Karen, because I know that you are definitely have been a person that has been committed to this particular cause, what would it be?
I would just say to dispel the misconceptions, and there's a lot of them. The first and foremost one, which is doctors and nurses are not going to save your life if you've registered to be an organ donor. Remember, the goal of doctors and nurses is to administer care. And organ and tissue donation is only involved after someone passes away at the hospital, after 2 doctors have determined that someone has passed away. We are not involved in the process before that time. So remember that they're going to do everything they can to save your life. Only after every measure has been tried does organ and tissue donation ever get involved. And then we're notified of that death. We're not involved in the determination of death as part of that process. So just remember that get all the facts and information as you think about registering to be an organ donor. I think it's an important piece of the puzzle.
Okay, thank you. Thank you. And with that, I'm going to go to trivia question number 3 before I bring on Dr. Callender, who I think is going to tie this in wonderfully. Who can be an organ donor? If that should be on slide 9. That's your trivia question. Who can be an organ donor? Only people in good health. Anyone over the age of 30. C, anyone who should consider themselves an eligible donor. Or D, people without religious beliefs. So that is our trivia question number 3. Who can be an organ donor? And so before that particular answer should be, well, we know it's not people without religious beliefs. We know that it's not only people in good health. We also know that it's not anyone over the age of 30, because we know that everyone can be an organ donor. So yes, it is C, by elimination, that anyone should consider themselves to be an eligible donor. And our next panelist that I think will be do a phenomenal job in sharing that with us is Dr. Clive Callender, who will talk with us about health equity and donation and transplantation disparities. And so with Dr. Callender, why should anyone? I recall that one of the first things I heard you say was that the number one problem in transplantation was a shortage of organs. So Dr. Callender, please tell us, is that still true?
Yes, from the time I started in transplantation back in the 70s until now, the number one problem in transplantation has been the shortage of donors. Of course, as a consequence of this shortage, 22 people die every single day. So this is more important than rejection, more important than everything else. It's to get more donors to save more lives.
Dr. Callender, again, you are a trailblazer. I mean, we are getting history and we are getting a legend. And what a blessing to get a legend in this field. And you started this field, Dr. Callender, back in 1970s when you were just a kid. And so as a result of that, tell me, why is it still important for us to have something like National Minority Donor Awareness Month? And why is it still important for us to really focus on multicultural or minority education in our communities?
I want to share some information at the same time. Our United States Census indicates that we have 14% African Americans, 18.4% Latino Hispanics, and in total, we represent more than 40% of the people in the United States. Yet, on the transplant waiting list, we represent more than 60% people on the transplant waiting list. Furthermore, when we look at people who are transplanted, we still do not account for as many people as we have on the transplant waiting list. So until we get to the point where we are donating, let's say, for example, when I started out, we minorities were donating 15% of the organs that were transplanted. More recently, that figure has gone up to 35%. But as I mentioned, we represent more than 40%. So that until we reach a goal of, let's say, 45% of the people who are donating, then I think that we have to continue to do what we're doing. Furthermore, I think the area that we fall down the most is in living donor transplants. As a matter of fact, as you look at the data on living donor transplants, Blacks have been particularly poor in that regard. On the other hand, Latino Hispanics have been particularly good in the last couple of years. And so we have targets that I think we must identify and reach. And I think we want to have organ donors per million for minorities for the African Americans to be in the 40% range, and for the Latino Hispanics to be in the 40 organ donors per million range. That is not yet the case for the Latino Hispanics. It may be the case for African Americans deceased donors, but not for living donors. Now, the donor that is associated with the longest survival, the shortest wait before transplant, is a living donor. And it is almost embarrassing to see how few African Americans are living donors. And so if there was one area in particular that all people of color have to address, it is the shortage of living donors. And so we need to really do what some of the Latino Hispanic groups have done, which is put money and dollars into going into the community, educating and empowering the community. So the Latino Hispanic population has made a difference. We need to do more of the same like that in the African American community, and in the Native American community, and in the Asian Pacific Islander community. Because in those areas, live donation as well as deceased donation are not optimized. So there's still a long way for us to go. Recent data, I think John Hopkins just did a study, and they pointed out that while African Americans have markedly improved for deceased donation, the problem still exists for communities of color.
Wow, that's those are some interesting statistics. I think I'm a little surprised because I knew that African Americans had definitely increased in deceased donation, but I did not realize that African Americans were not participating in living donation as highly. And so I definitely think that educational campaigns like the MOTEP campaign that you have had over these years is definitely a way for us to have this conversation. But in that conversation, Dr. Callan, because there might be hesitancy, I shouldn't say might, because the data just said that there is hesitancy for African Americans to become living donors. How do you think stuff like that happens, and why? And how do you think COVID-19, which has also shown more health inequities, how do you think that is impacting the number of minority donors and transplant recipients, and those persons who might just be reluctant to participate a little bit more fully in the healthcare equity?
They were already reluctant before, and what has happened is that COVID has unmasked the majority-minority health disparity, and has identified how people of color, because of this social determinants of health that I have hallmarked the issue. We now recognize that more people are dying because of COVID, and because of this majority-minority health disparity. So it is important for us to go into the community. Now, I mentioned that distasteful thought, going into the community. How can you go into the community when you have COVID? Well, how can you not go into the community? We have a responsibility. Now, I think webinars like this show us one way to do it. But there are other ways to do it that we must utilize. We must try to actually get to the community, even if it's in small numbers. We've learned that face-to-face efforts are the best. But because of the perils associated with COVID, we have not optimized or maximized our efforts. And I think this then is a problem. We also have to have people that look like us go into the elementary schools, the junior high schools, the high schools, and the colleges. Not forgetting that we need to start at the very beginning, because systemic racism is the big problem. And the way to address systemic racism is by having people of color going to the elementary schools, the junior high schools, the high schools, and letting them see us and know that we are here for them, and we're willing to give them the information that is the power that can make a difference.
I agree. You mentioned, Dr. Callender, the social determinants of health. I know that, Daniel Dawes would also suggest that there are also political determinants of health. And how can maybe some of those things, how can we help to maybe address some of the health inequities in this particular system that might make people feel as though it's more equitable? You know, is there some type of policies or things or legislative initiatives that we should be involved in to make those things happen?
Well, I think one of the areas that we're least effective at is addressing the political determinants of health. Most of us will address getting to the community. Most of us are not effective at changing the rules and the regulations and the laws. And we must realize that there are laws that put us at disadvantage, that have the fact that the social determinants of health exist is not an accident. It was caused. And so we need to be more politically capable and more politically interested. Educating and empowering is part of it, but going to the political realms and getting the congressmen and others to make the laws more favorable and to allow us to not have the food deserts, not to have the economic instability that affects us so much more than other communities. Now the question is, how do we go to the community and get them to be politically active? How do we go to the Congress of the United States and testify? This is something that I've done through the years, but not enough of us are doing that. And so we need to do that much more, because the social determinants and the political determinants of health are critical for us to eliminate.
Okay, I agree, and so I think you're kind of always already kind of hitting upon that. But Dr. Callender, again, I know that this MOTEP model that you have provided for us over 25 years ago is still an effective model. And even though we cannot sometimes go as safely in the community right now because of COVID-19, the need still exists. And so, you know, we've got to find ways to get this information into the communities. And so how would you suggest that we use and try to spread this information both, you know, in the communities? I know that, you know, we're always talking about doing the churches, just a shameless plug. Today happens to be, my organization's International Day of Prayer. How do we get this information into communities of color? African American, Latinx, Asian American, Native Americans, to really engage them in the political determinants of health, the social determinants of health, but more importantly, the community empowerment process of health.
Well, one of the things that I think we have to do as we go into the community, we have to recognize that we can be helpful not only and I think Love Yourself, Take Care of Yourself does this very well. It goes into the community and says you need to adopt healthy lifestyles. And it not only deals with increasing organ and tissue donation, but it deals with educating and empowering the community so they will live healthier, adopt healthier lifestyles. Also, to help them to recognize that we care about them and that we love them. And so we do those things, we show that by helping them out by the areas of the social determinants of health, education, economic stability. So we can't just go into the community and just talk about organs and tissues. We've got to go to the community and talk about how can we make things better for you so that you can get your medication, so they can do those little things that become very important to them. How can we ensure that they get food that is not only in the food deserts, that McDonald's and Wendy's and those people don't thrive. So that those are the little things that we can do to show that we love and that we care, and that so we're not only just interested in getting your organs and tissues to love yourself, take care of yourself. We want you to be the best you can be and to overcome those 5 social determinants of health: economic stability, education, social interactions. And these, I believe, are the ways in which when we go into the community, we can make a difference that must be made so that we really love and care about them. And so we're not there just for their organs. We also want to emphasize the importance of going from awareness to action to accountability. So we get the data to look at the ways in which end-stage renal disease, whether the disease is actually slowing down because the incidence rates are dropping. And so this has to be part of what we want to do. This, along with us as transplant health professionals, actually getting into the schools and all of the barbershops and other places that meet them where they are. I think these are just some of the ideas that I have to make us be more powerful and more emphasize how much we really care about the community and want to make a difference that must be made.
Oh, I definitely believe in. Oops, that was one of the great things about the MOTEP model was health prevention. That you have to love people on the front side and on the back side. So, thank you so much, Dr. Calendar. We have a question, and the question is: does the vaccine prohibit people from donating organs?
Okay, the answer is no, it does not, and I think it's a good time to emphasize how important it is for people of color to take the vaccine. And if you've taken the vaccine and you've had a vaccine more than 6 months, then you're going to need a booster shot. So we have been particularly poor in terms of getting the vaccine. And this is something that we should include in our MOTEP message, by the way, to show them that we care. We're not there just to get the organs and tissues. We're there to help them to improve their lifestyles.
Okay, I do concur that we include in our message in MOTEP here in Detroit that we should get the vaccine. That is absolutely true. And we have another question. It says, does the vaccine change anything about our makeup? Because that has been one of the concerns.
Yeah, this has been clearly established that the RNA vaccines, which you refer to, do not change your DNA, RNA, or anything else. So it's a safe vaccine, and it's something that we should eliminate. Karen talked about the myths about organ and tissue donation. We need to eliminate the myths about the vaccine as well.
Okay, and so and that's also inclusive of persons who are recipients as well. So,
and of course, recipients need to get that booster more than anybody else because they aren't able to mount an effective immune response without that booster shot. So all of the transplant patients and immunosuppressed patients of any kind need to get that booster shot, and those who are not vaccinated need to be vaccinated.
Okay, thank you, Dr. Calendar. Once again, for everyone, now you understand why I have so much admiration and respect for Dr. Clive Calendar. He provides information and inspiration like no one else I know. And so because of that, we're going to go now into our third panelist, who is going to tie in this particular story. Ms. Cherie Watson, who is who's a liver transplant. Cherie, please tell me, what are some of the events that maybe led up to you needing a liver transplant? I'll let you tell your own story, but if you can include that, that would be helpful.
So thank you, Ramon, for asking. So when I was about 20, I was a senior in college, and I started having symptoms of inflammation of my colon, of my GI tract, my gastrointestinal tract. And about, 3 or 4 months later, I was diagnosed with inflammation of the colon because of sort of an overactivity of my immune system, so autoimmune disease. And in addition to that, I was also having signs of inflammation of my liver. And about a year later, it was finally determined that I not only had inflammation of my colon, but also inflammation of the liver and the part of your system that helps you to digest food. So my bile ducts were also inflamed. That disease is called primary sclerosing cholangitis, which is ultimately the thing that led up to my transplant. Primary sclerosing cholangitis doesn't have any current treatment. It's a disease that we know progresses naturally to causing end-stage liver disease as well as bile duct cancer. So when I was about 30, I had developed cirrhosis of my liver and signs precancerous in my bile ducts. And a few years later, that had, I had progressive liver disease. And up until that point, the liver disease was present, but not causing me to not be able to do my regular activities. So I was able to finish college, finish medical school, complete my residency training in pediatrics. So performing at a high level still, but then I developed a really bad infection in my bile ducts and almost died of infection and organ failure. And that was when I was ultimately diagnosed with cancer in my bile ducts. And so after getting some preliminary treatments with chemotherapy and radiation for the cancer in my bile ducts, I was then listed for transplant in the fall of 2014. Fortunately for me, it was a long wait for how it felt, but compared to a lot of other people, not as long as many people have to wait, but about a year later, I received the gift of life of liver from a deceased organ donor. And so fortunately for me, someone was kind enough to register to be an organ donor and let their family know that they were an organ donor, and I was able to receive a liver transplant.
Wow, that is a phenomenal testimony and story, especially by you being in the medical profession. You were, as you said, you were going through medical school and all that, and so you probably knew all of the challenges of the wait list, whether or not you could receive a transplant or not. So tell me some of the experience or thoughts that that you had in that particular time. Is it something that you tried to also educate more people about organ donation?
So it definitely, for me, was a benefit to be in the medical field and have more knowledge about the disease or diseases that I have, because it made it less scary, I think, some of the things that happen. Because what happens with autoimmune diseases is that you don't necessarily always feel sick. It comes and goes. So there are days and months where you feel completely fine. And then there are other times where there's a flare of the inflammation and you're doing really poorly. Knowing that, things can get better with some of the medications that are available, even if they're not curative, they are able to help treat some of the symptoms. Knowing that those things are available definitely made things more tolerable for me over the years, but it was still difficult to accept that I have this disease that has no cure except for a liver transplant. So before I ever really needed the transplant, I knew that I would eventually need one. And so it made me feel somewhat helpless at times. And, being a young person and having my plans for the future, for my career and for family, not knowing what was going to happen or when it would happen was really difficult to cope with. But like I said, knowing that there's a lot of research that is going on and that there are clinical trials available and that transplant was even an option for me, all of those things definitely helped me to keep a more positive outlook much of the time.
Okay. So Dr. Watson, tell me, how has your life and your health changed since receiving this transplant? I mean, it's like, I could just feel your spirit just kind of like jumping through this electronic medium here. But, if you could put into words, how do you feel now? What has this transplant meant to you?
So, I mean, this transplant saved my life, literally. Before my transplant, particularly after I got so sick, I lost a lot of weight. I was weak and cold and tired all the time. I actually, ended up having to withdraw from my training program a few months before finishing because of my deteriorating health. Once I got my transplant, and so it actually even took some time before they were able to list me for transplant because I wasn't healthy. I wasn't healthy enough to be listed for transplant for it to be considered a worthwhile, I guess, investment in how I was doing. But I was too sick to do anything else. So, but once I got my transplant, right afterwards, there was a lot of catching up to do because I had been so malnourished and so poor in my health. But within about 6 months of my transplant, I was actually back to running, which is one of the things that I enjoy doing. I was able to start dancing again. Since my transplant, I've actually run 4 half marathons, I think. And before my transplant, actually, right before I got very sick, I was in the process of training for a half marathon. And one of the, big things while I was waiting for my transplant, which was a very depressing time for me because it was just that not knowing, was that my therapist, who there are psychiatrists that are specific to transplant patients. And, she advised me to look forward to something, plan for something that was going to happen after my transplant so that I would think about what life could be like on the other side instead of the constant worry about what if I don't get a transplant in time. And so one of the things that I decided was that I would actually run that half marathon that I didn't get to do because I got sick. So yeah, since then I've run a few of them. And I've done a lot of other things. I've been able to travel and I've been able to visit family and, do the things that make my life enjoyable. And so it's been really a blessing and really truly a gift that I'm able to live a flourishing life.
Wow, that is absolutely awesome. And, kudos to you on those half marathons. I cannot even think about a half marathon, but just kudos to you. And again, just about all the wonderful life experiences that you have shared with us as a result of you receiving the gift of life. And so, we have a couple of other questions. And so since I have 2 physicians, Dr. Callender and Dr. Watson, I am going to ask you the questions. It says, you kind of changed the questions on me. If there is a tissue match, I'm sorry, that's not the question. Is it possible to direct donation to someone of your own choosing, race, or ethnicity? I'm going to leave that up to Dr. Callender and Dr. Watson.
As I tried to answer that in the chat, it is not desirable, but for example, if you're going to do it, the direct donation, and you had somebody in mind, and you're a live donor, you could do it that way if you wanted to. For deceased donation, it is neither desired or recommended because we wanted to go to the person with the best match. We know for a fact that the transplant outcome is determined by the closeness of the HLA match and the absence of sensitization or antibodies that are directed against the donor. So that's what is the most important. So that, in my opinion, it is unnecessary and undesirable to recommend that to give them to somebody of your ethnicity, unless if you have someone in mind, you want to do it live, that's fine, because they need an organ, and live donation from anybody is desirable. But for deceased donation, it's not desired or recommended. What is recommended is you go to the person who has the best tissue match.
Okay.
Yes.
Okay. All right.
I second that. Yeah, and the other thing, the question of, can you can you direct your donation to a particular person if there is someone you know who is in need of. So the two organs that you can do living donor transplants for are for kidney donations primarily, but also for liver transplants.
Yes.
And so for those two organs, if there's someone who needs an organ and you want to donate either a kidney or part of your liver, then that's in that situation, it is a directed donation that you're doing. And you would just need to be evaluated to see if you are a match for that person.
And
In the
can
event
I
that you're
chime in
not a
here?
match,
I'm sorry, go ahead.
in the event that you're not a match for that person, you may very well be a match for someone else, in which case you could still give the gift of life to someone else, even if it's not someone you know.
Okay.
I
Shani?
agree with everything that was said, but I think for us at Live on New York, one of the first questions we ask is if you know of somebody who may be on the waiting list that deceased donor could benefit. We of course have to test them to see if they will be a match. We take them through the normal processes, but we do ask families if they are aware of someone who may be waiting, that if they would like to direct the donation. It's one of the first things that our family services advocates ask.
Okay. All right. Thank you. Thank you for that lively discussion. And we have a question in the chat before I bring in Nancy. I love the way that people are asking questions because they want to make sure this is an authentic discussion going on. So the question is everyone on the panel a registered organ donor? So
yes.
Can we all give a thumbs up? Yeah.
Yep.
So yes, all of us are registered organ donors. That is always a great question because again, that's what you call really kind of community empowerment. People like, tell me, what are you doing before you ask me to do something else? So thank you so much for that question. Our
and
next
also addresses the question of who can be an organ donor. I have had a transplant myself. I've had cancer myself. I'm sure there are some other risk factors that I have that would make someone think, oh, you can't be an organ donor. And despite those things, I still can be an organ donor. And if the time, came that I passed away, or if there's someone that I know that needs an organ, they would evaluate me in just the same way they would evaluate anyone else instead of counting me out right from the beginning because of my history.
Okay. Thank you for sharing that, Dr. Watson. So Nancy Ullen is going to join us now for preventative health care. And Nancy, you've heard these conversations. You've heard us talk intermittently about organ donation and prevention. And please share with us why preventative care is so important, even when we're having this discussion about organ and tissue donation.
Right. I think it's really important to actually even start with defining preventative care, because often people think if I see a healthcare provider, that implies that I'm not well. So therefore, I won't go see a healthcare provider, and thus I may be healthy. And so I think it's important to recognize that preventative care is really focused on taking steps to prevent disease. And what we know is that every year, millions of people die from diseases that could have been prevented. And which is why regular screening with a trusted healthcare provider is necessary. Often diseases such as high blood pressure, kidney disease, they have no physical symptoms until much later in the disease process. Mm-hmm. And additionally, as these disease processes get worse, the long-term effects have a tremendous impact on quality of life. So having regular preventative care is important to catch these types of diseases and offers an opportunity to receive timely and supportive treatment. So it is definitely better to prevent disease rather than treat it. And in the United States, by 2030, it's actually estimated that 80 million people will have at least 3 chronic diseases. So, we want to remember that old adage that prevention is better than cure. And having preventative care, again, with a trusted healthcare provider, is really a supportive tool that will allow a person to take a much more proactive approach in his or her overall health goals.
Wow. Could you repeat that statistic one more time? That was a little startling for me. By 2030,
Yeah, 80 million people in the United States will have at least 3 chronic diseases. And often these are diseases that if we had been screening, we could have seen much earlier in the process. Again, hypertension, diabetes, kidney disease, and so having preventative treatment is very important. It doesn't always imply that you're not well. Often I hear people say, "I'm well. I have no medical history. I haven't seen a doctor in years." And usually that's an alarming statement, because what that implies is that the person actually hasn't been screened or hasn't been seen. So preventative care is a good thing. In fact, we do it on our automobiles pretty regularly.
Yes.
at least every 5,000 miles, right?
Exactly.
Again, like you said, those oil changes, 3,000, 5,000 miles. I might have just told on myself. But making sure that we're getting those things done. But Nancy, help, because a lot of times people will say, look, my healthcare provider told me that my blood pressure was high, but I am feeling fine. I'm not having any symptoms. And because I'm not having any symptoms, I'm not going to take my blood pressure pills. What do you say to discourage those type of behaviors?
Right. I mean, I think this is one thing we have to really appreciate is that about a third of people who are on dialysis actually didn't have care by a nephrologist prior to starting dialysis, which is an alarming statistic, but it's also an alarming approach, because that often implies or is suggestive that these people didn't even have a primary care provider in order to get to a nephrologist prior to starting on dialysis. So, and hypertension or high blood pressure is actually the second leading cause of kidney failure. Kidney failure is one of those things that will put somebody on a transplant list. And high blood pressure often has no physical symptoms. So for a person to tell me that he or she feels fine, it's absolutely likely accurate. They probably do feel fine. But this is why it's called silent, and why it's called a silent killer, is it doesn't give us physical symptoms often. And so it's important, because preventative care can screen this and can discover that one's blood pressure is elevated. 24% of Americans have high blood pressure, so that's 1 out of 4 people. And if you don't know your blood pressure is high, or if you're avoiding the medications because often they have side effects, over time it could be that hypertension or high blood pressure progresses to kidney failure. And a lot of the efforts that could have been in place to prevent kidney failure is really lifestyle changes that the individual has control over. And I would just add that high blood pressure left untreated doesn't always just end in kidney failure. It can have impact on the heart, the eyes, many different organs. So certainly it's understandable if one feels fine. So is curious as to whether he or she should take the blood pressure pill. But I think the biggest part is if you trust your provider and feel comfortable, you have the power to have open dialogue in order to treat the hypertension and or the disease that one is needing to be treated for.
Okay. So that gives me a lot of comfort, because I tell people, they tell me I'm borderline hypertensive or borderline diabetic, and I tell them until you can become borderline pregnant, you're either hypertensive or you're diabetic. So until that happens, there's that. But one of the things, Nancy, a lot of times that we hear about people like we've been we've heard us talk about this mistrust of the healthcare system. And many people just not trusting their healthcare providers. And, we've seen that again with people going to the doctor. And we've really seen it again with this whole vaccine. So how do you tell people to talk to a healthcare provider that they might not trust? And how can they become more comfortable in building that type of relationship that will enable them to build trust?
I think it starts with letting the people know that perhaps it is mistrust that you're feeling. That if that is the emotion that one is feeling with his healthcare provider, that it's okay to recognize that, and it's okay to feel that. Really, the individual has to be empowered to achieve his or her own personal health goals, and so. I have to say, to what Dr. Callender said earlier, it really comes with loving the person and demonstrating that. As a healthcare provider for many, many years, it was important for me to get outside of the healthcare system and into the community, because the healthcare system is a disease management system. The community is the healthcare system. And if we can shift our thinking and realize that actually in the community, amongst each other, our barber, our hairdresser, our faith-based institution, our library, these are the areas where we have developed wellness. And so I think to recognize that it's okay if you feel mistrust, but it's not okay to stay in the situation if you feel mistrust. It's time to be empowered and change healthcare providers. So I would always begin with encouraging the person to get recommendations from his or her family. I mean, because what we don't want is a person to mistrust a provider and then therefore leave the provider and have no health care, have nobody to turn to. So I think it's important to recognize it, that it's true and exists, and that too, who is somebody else that I could possibly trust given other recommendations. And then, we have to recognize after the visit, did I feel comfortable asking my questions? Did I get the answers that were understandable? And did the provider listen? So definitely important not to stay in that state if you feel that way.
Okay. Dr. Watson or Callender, you want to weigh in on that as well?
Well, I have a concern that very often when we talk about love yourself, take care of yourself, we don't realize that, as Nancy has said, an ounce of prevention is worth a pound of cure. And I've emphasized 5, 6 items, one of which I tend not to emphasize, but I think it's important, is that if you have protein in your urine, that's the earliest sign of kidney disease. And that's the time when you should be counseled by your physician that you need to see a nephrologist. If you might have to test repeated to be sure that it's positive. But if you get protein in your urine, down the road, you're going to lose your kidney. So that's the time to start dealing with it. We've been criticized that the Western medicine emphasizes, as Nancy had mentioned, management. But in point of fact, we should emphasize prevention. And I think along those lines, I never cease to emphasize the importance of exercising, and not only exercising, but meditating, and spending at least 150 minutes a week in both activities, exercising and meditating. Realizing that fried food's not good for you, red meat's not good for you. To realize vegetables and fruits, what we should be eating, and more fish, less red meat. Also checking the blood pressure twice a year after the age of 12, because we get people of color get high blood pressure earlier than other people. And so these are some of the points that I think become important. Weighing yourself daily, because if you really love yourself, take care of yourself. Maybe we can lower the incidence of end-stage renal disease and have more people who can be donors in life and after.
Okay, Dr. Watson.
Well, I wanted to second what Nancy said about finding a doctor that you do trust. If you don't trust your doctor, if you don't feel comfortable, no matter how, good a doctor, how highly recommended they come, if you and that person aren't able to make a connection, then you find a different doctor. Your doctor will be fine. They will still have other patients to see. And I say this because, in my personal life, I know a lot of people who I've encouraged to switch doctors, because when I talk to them about, what's going on with their health, they don't have a good handle on it, or their doctor hasn't brought up to them certain things that, to me seem like they should have been brought up. And the reason they don't want to switch doctors is because they don't want to hurt the doctor's feelings. And I mean, even if the doctor's feelings are hurt, which is probably not going to be the case, that's still less important than your own health. And so, finding someone who you feel comfortable talking to, and then being honest with the doctor, really do tell them how much you drink each week. They're not going to judge you on that, but they'll be able to take better care of you if they have the right information. And going to the doctor doesn't mean that you're sick. You go to the doctor to stay well. And that's sort of the way that we need to sort of refocus people's perspective on what it means to interact with the healthcare system, is that you're doing it to take care of yourself, not because something is wrong with you. And if there is something wrong, then what better place to be than to have a doctor that you can talk to and trust, and who will do the right things for you. The other thing that I wanted to say about preventive health is, if possible, I encourage people to bring someone with them. And I know that COVID has made that much more difficult, obviously. But as we get back to being able to have one other person with us at healthcare visits, I think, even for myself as a doctor, I bring someone with me, because when you're the patient, you're going to miss things, and two heads are better than one. And, if you didn't feel anything, in particular about the doctor, the person you brought with you might be like, oh, I don't like how that doctor did X, Y, and Z. And you may then be like, it stood out to me too, and I just thought it was just me, and it wasn't just you. So it helps to have a second person there, as well as to help you to remember, what did the doctor say? Because everyone has had the experience where they leave a doctor's visit and they have no recollection of what was said. And it's definitely happened to me. Or you forgot to ask all the questions that you thought you were going to ask during the visit. So I think, having that support and someone else to help to advocate on your behalf is really important.
I concur, and I think that doctor-patient relationship is so phenomenal. I had a phenomenal physician. They retired from, and it took me like 5 years to find another person that I really felt strong and comfortable with. So I think that that's very important. So again, I think this is, and also just listening, that it takes the entire community, that it takes, people from the faith community, people from the medical community, community organizations that people already trust, for all of us to be involved in the conversation. And I think that's one of the things that our organ procurement organizations now realize more than ever, that it will take all of us in this conversation to make a difference. And so, again, I am just excited. I should have on silver today in celebrating our 25th year of National Minority Donor Awareness Month. But if you had one statement that you would like to kind of leave us with today, as we talk about this, what is it? I know, again, we have MOTEP here. We have Howard University. Dr. Callender, you're wearing 2 hats, but I'll take the MOTEP hat from you today if necessary. I can't take it from you because you're the founder. We have Dreyfus Health Policy and Research Center. We have Rise Up. Rise Up. We have Dr. Watson here, who has shared her personal testimony. And we have my colleague again, Karen Cummings from Live On New York. And so I might have to kind of call Shani back in to make sure that we get all voices. But again, what is the message today? That if you were on national television and that you could get it out today, what would your message be on today?
Uh, One of the things that I think that has been evident throughout this conversation is that systemic racism is one of the biggest obstacles to all mankind. We talk a lot about it in the United States, and we have it quite amply, but it's all over the world. And this is why COVID has been such a, that's why it has been unmasked by COVID. And so one of the things that we need to be able to address and recognize the malignancy of systemic racism is to recognize that we're all humans. We're all one race. And therefore, diversity is our greatest strength. And so, whatever we can do to promote diversity and to recognize that there's no one superior or inferior group, that we're all one of the same. I think that is the message I'd like to get across, because I think that covers all of the areas that we talked about today, and will help all mankind.
The message that I would like to, first, I'd like to second what you just said, Dr. Callender, because that's extraordinarily important to be aware and keep in the forefront of our, as we pass through this world. The message that I want to say to everyone is, register to donate. And being an organ donor doesn't mean that anyone will treat you any differently when you walk into a hospital. As a doctor, I can say that I have no idea what the organ donor status of my patients is when I'm taking care of them. That is not at all what people focus on when they're taking care of you. So register to donate, talk to your loved ones about your decision to donate, and encourage them to also become organ donors.
The message I try to say every time I have the opportunity is, number one, is that that one is not at risk for disease based on the color of his or her skin. And too often we go through nursing school, medical school, perhaps thinking that, or hearing rather, African Americans have a greater risk of, and then the list goes on. And it took years in my career to start asking, is there a place for race-based medicine? And so I want the people that I care for and take care of understand that it's not the color of the skin that puts you at risk. It's systemic racism that has been embedded for too long and has been an uncomfortable conversation. So anytime I can make one uncomfortable to bring it up, I try to do that, because I don't want my patient to leave, a patient of color, thinking, oh, well, because I'm African American, I'm going to get hypertension, diabetes, etc. So that, and also where at Dreyfus Health Policy and Research Center, we actually don't say social determinants of health. We rephrase that and call it social opportunities for change. So these are not determinants implying that they're static and can never be changed. Our hope is that they're opportunities, and we're going to be a part of those opportunities and change those for people that are at risk for diseases based on systemic racism.
Wow. That is
well said.
Wow. So we're going to have this panel back, because I think to end on this particular, or almost end on this particular, I will admit I am sitting in Tulsa, Oklahoma, and I am here today about, and I have had this weekend, I have been involved in something that just seems almost unimaginable, and that Tulsa, racial massacre, 1921 is hard. And so I am happy to hear that there is, that Dreyfus is talking about having opportunities and creating opportunities to change the narrative. And I think that's one of the things that National Minority Donor Awareness Month does. I think that's one of the things that Dr. Clive Callender has done in his career, as he's changed the narrative. And when you change the narrative and you tell the story differently, the outcomes become different. They can never become different, however, if the narration stays the same. And so I want to say thank you for that. I know that Shani is not on stage with us, but I am going to ask her if she will that that this conversation once again is about humanity. This conversation, I think that if nothing that the last 18 months, it seems like it's been 2 years, but 18 months have shown us with COVID-19 is that we are one humanity. It has shown in every area of our lives that is no such thing as a rich world and a poor world per se, that when the world is affected, the world is affected, and it will affect and impact all of us. And so with that, I'm going to welcome my colleague, Karen, on back in. Karen, you missed some rich conversation here, but I know that we'll have a chance to continue it at some other time. I want to say just thank you for allowing me to be a part of this conversation. So I would like to say to Dr. Callender, to Nancy, to Dr. Watson, Nancy, and I just didn't want to mispronounce your last name again. Is it Ullen?
Euland.
Euland, okay. I am sensitive to people's names. So, it's Euland, everyone. So Karen, if you will kind of come back in and just, thank you, thank you, thank you.
I miss Nancy's amazing comments about humanity, and I think
yes,
I just second, third those comments. I think it just emphasized over the last year and a half how important that is, just the care and respect for others, whether you're in the health space or not. And just we talked about empowerment, and I've heard that from everybody. But it's also important to have an advocate, right? If you can't make those decisions for yourself, then you can bring an advocate with you, whether that's to your doctor's appointment, that is speaking to your healthcare professional. Also take an advocate and have an advocate with you. So I just appreciated all the comments and love being part of the panel, and thank you for having me.
Thank you. Thank you. I think our host organization, Kathleen, will come back to join us once again. I just want to say thank you.
Hello, and thank you so much for that wonderful time that you've been able to share with us about organ donation. And I truly just want to say how much I appreciate a new language, to add to this piece, because when I hear social determinants of health, I have to admit it does bring about a lower vibration, but I truly appreciate social opportunities for change. So if you don't mind, I'd like to borrow that moving forward. I also want to invite you to stay tuned. There is so much more that will be coming from Juneteenth, New York City, family, and the whole Real Talk conversations that are coming up. Our next Real Talk actually will take place on September 19th. I trust that all is well for you, that you will be using this newfound knowledge and insight around organ donation, and just, when it's time for you to sign up for to get your licenses renewed, or, just sitting and having conversation with your family. It sounds like there's so many opportunities for this to become a part of a family, discussion and conversation. Thank you so much to everybody in the audience who has taken your time out today. We look forward to seeing you again September 19th. Until such time, bye for now.